Since the early Odys observations, 1886-1887, it was known that the pancreatico-biliary sphincter offers a tonic resistance to flow. Evidence of a local phasic activity was obtained, however, only in the late 50s. This video cassette is a selection of film sequences recorded during intra- or postoperative cholangiography in man, 108 cases, and dog, 25 cases. A 5 inches image amplifier with optic magnification, a Kodak 35mm supersensitive negative film at a speed of 16 frames per second were used for these studies. Cinefluorography was in 32 cases synchronized with electromanometric recording from the gallbladder or the common bile duct. Closing and opening sphincter movements to be interpreted as phasic contractions and decontractions can be seen. The long dog's interduodenal funnel-like segment of the sphincter is clearly visible in one of the sequences. With only one exception, phasic sphincter movements are associated with duodenal activity. Phasic sphincter closing and opening movements suggest that also in man, the terminal segment of common bile and pancreatic ducts is endowed with a phasic motor activity. A small amount of contrast medium occasionally refluxes into the pancreatic duct. Intracholedochal pressure was not recorded in this case. Two closing movements are apparently not associated with duodenal contractions. In these sequences, the effect of morphine can be seen. Morphine induces a long-lasting closure of the sphincter channel. The resistance of the spastic sphincter could be overwhelmed by raising intracholedochal pressure. The synchronized manometric tracing shows a progressive increase of the common bile duct pressure. Amyl nitrate determines a transient sphincter relaxation and a reduction of common bile duct pressure. The effect of morphine is shown again in this sequence. The apparently stable spasticity of sphincter contrasts with the active duodenal motility. The Yorps and Moot cholecystokinin relieves the morphine-induced sphincter spasm. CCK appears to be the most powerful physiological relaxant of the sphincter of Oddi. This stone, located in the distal part of the choledocus, blocks flow of contrast medium into the duodenum. Morphine and CCK have been administered. Contraction and decontraction of the sphincter on the stone are clearly visible. The stone is displaced proximally by the active contractions of the sphincter. The sphincter itself then relaxes, and contrast medium can flow freely into the duodenum. Closing, contraction, and opening, decontraction movements of the sphincter are visible in detail in the following sequences. The closing movement apparently consists of an annular contraction at about halfway along the sphincter channel and then progresses proximally until obliteration of the distal choledocus. At the same time, the distal part of the sphincter channel empties slowly into the duodenum. The opening movement appears as a downward progressive relaxation of the sphincter. Both movements are therefore followed by flux of contrast medium into the duodenum, even if in a different proportion. This patient has been submitted to surgical partial distal sphincterotomy. Closing and opening movements of the residual sphincter, both dependent and independent from duodenal contractions, can be visualized. Cinephorography shows that the sphincter of Oddi possesses a phasic motor activity related to the pancreaticobiliary flow into the duodenum, and which appears to be relatively independent from duodenal motility. In man, the physiologic role of the sphincter appears to be primarily obstructive.